Hashtag Mental Health Disorders, a comprehensive guide to depression, anxiety and suicide risk. Mental health disorders represent one of the most pressing public health crises facing American society today, with depression and anxiety rates reaching unprecedented levels across all demographic groups while suicide emerges as a leading cause of death among young people. This comprehensive examination reveals the intricate web of biological, psychological, social and environmental factors that contribute to these devastating conditions while providing essential knowledge for recognition, intervention and prevention strategies that can save lives and restore hope to millions of affected individuals and their families. The magnitude of mental health challenges in contemporary America cannot be overstated, as recent epidemiological data demonstrates that approximately 1 in 5 adults experiences a mental health disorder in any given year, while 1 in 6 youth aged 6 through 17 experience a mental health disorder annually. These statistics represent not merely numbers but real human suffering, broken families, lost potential and preventable tragedies that ripple through communities nationwide, demanding urgent attention from healthcare professionals, educators, policymakers and society as a whole. Depression, clinically known as major depressive disorder, stands as the leading cause of disability worldwide and affects more than 17 million American adults each year, representing a complex neurobiological condition characterized by persistent feelings of sadness, hopelessness, worthlessness and loss of interest in previously enjoyable activities. This debilitating disorder disrupts every aspect of an individual's life, from personal relationships and academic or professional performance to physical health and overall quality of life, creating a downward spiral that can prove fatal without appropriate intervention and treatment. The clinical presentation of depression varies significantly among individuals, yet certain core symptoms remain consistent across populations, including persistent depressed mood lasting most of the day nearly every day for at least 2 weeks, markedly diminished interest or pleasure in all or almost all activities, significant weight loss or gain unrelated to dieting, insomnia or hypersomnia, psychomotor agitation or retardation observable by others, fatigue or loss of energy, feelings of worthlessness or excessive guilt, diminished ability to think or concentrate, and recurrent thoughts of death or suicide. These symptoms must cause clinically significant distress or impairment in social, occupational or other important areas of functioning to warrant a diagnosis of major depressive disorder. Young people face particularly alarming rates of depression, with adolescents and young adults experiencing unprecedented levels of mental health challenges that have increased dramatically over the past 2 decades. Factors contributing to this epidemic include social media influence, academic pressure, economic uncertainty, climate anxiety, social isolation, family dysfunction, trauma exposure and neurobiological vulnerabilities that make this population especially susceptible to developing severe depression during critical developmental periods when brain plasticity and identity formation are at their peak. Anxiety disorders, encompassing generalized anxiety disorder, panic disorder, social anxiety disorder, specific phobias and separation anxiety disorder, affect more than 40 million American adults annually, making them the most common mental health conditions in the United States. These disorders involve excessive fear, worry and behavioral disturbances that significantly impair daily functioning and quality of life, often co-occurring with depression in what clinicians refer to as comorbid conditions that complicate diagnosis and treatment while intensifying symptom severity and functional impairment. Generalized anxiety disorder manifests through persistent, excessive worry about various life domains including work, school, health, family and future events, accompanied by physical symptoms such as restlessness, fatigue, difficulty concentrating, irritability, muscle tension and sleep disturbances. Individuals with this condition experience uncontrollable worry that is disproportionate to the actual likelihood or impact of feared events, creating chronic distress that interferes with relationships, productivity, and overall well-being while consuming enormous mental and emotional resources that could otherwise be directed toward positive life experiences. Panic disorder involves recurrent, unexpected panic attacks characterized by intense fear or discomfort that reaches peak intensity within minutes, accompanied by physical symptoms including heart palpitations, sweating, trembling, shortness of breath, feelings of choking, chest pain, nausea, dizziness, chills or heat sensations, numbness or tingling, derealization or depersonalization, Fear of losing control or going crazy, and fear of dying, these terrifying episodes often lead to persistent concern about additional attacks and maladaptive behavioral changes designed to avoid situations where panic attacks might occur, resulting in significant lifestyle restrictions and functional impairment. Social anxiety disorder, previously known as social phobia, involves marked fear or anxiety about social situations where the individual might be scrutinized by others, including performance situations, social interactions, and being observed while eating or drinking. This debilitating condition extends far beyond normal shyness, creating intense distress and avoidance behaviors that can severely limit educational, occupational, and interpersonal opportunities while perpetuating cycles of isolation and decreased self-esteem that further reinforce anxious beliefs and behaviors. The neurobiological underpinnings of depression and anxiety disorders involve complex interactions between genetic predisposition, brain structure and function, neurotransmitter systems, stress response mechanisms and environmental influences. Research has identified alterations in brain regions including the prefrontal cortex, anterior cingulate cortex, hippocampus and amygdala, along with dysregulation of neurotransmitter systems involving serotonin, norepinephrine, dopamine and gamma aminobutyric acid, creating neurochemical imbalances that contribute to symptom development and maintenance while highlighting the biological basis of these serious medical conditions. Genetic factors play a significant role in mental health disorder development, with family and twin studies demonstrating heritability rates of approximately 40 to 60% for depression and 30 to 40% for anxiety disorders. However, genetics alone do not determine mental health outcomes, as environmental factors, life experiences, trauma exposure, stress levels and protective factors all contribute to whether genetic vulnerabilities manifest as clinical disorders. Emphasizing the importance of comprehensive prevention and early intervention strategies that address multiple risk and protective factors simultaneously. Environmental and psychosocial risk factors for depression and anxiety include childhood trauma and adverse experiences, chronic stress, social isolation, poverty, discrimination, relationship problems, academic or occupational difficulties, medical illness, substance abuse, sleep disorders and exposure to violence or disaster. These factors can trigger the onset of mental health disorders in vulnerable individuals while also exacerbating existing conditions and complicating recovery processes. Highlighting the need for trauma-informed care and comprehensive treatment approaches that address underlying causes rather than merely managing symptoms. The relationship between depression, anxiety and suicide risk cannot be overstated, as these conditions significantly increase the likelihood of suicidal thoughts, behaviors and completed suicide. Approximately 90% of individuals who die by suicide have a diagnosable mental health condition, with depression being the most common underlying disorder, followed by anxiety disorders, substance use disorders and other psychiatric conditions that create overwhelming psychological pain and hopelessness while impairing judgment and problem-solving abilities necessary for crisis resolution. Suicide represents the second leading cause of death among individuals aged 10 to 34 in the United States, with rates increasing dramatically over the past 2 decades across all age groups but particularly among young people. This devastating trend reflects the inadequacy of current mental health systems, social support structures and prevention efforts while highlighting the urgent need for comprehensive suicide prevention strategies that address risk factors at individual, family, community and societal levels through coordinated, evidence-based interventions. Warning signs of suicide risk include talking about wanting to die or kill oneself, looking for ways to kill oneself such as searching online or obtaining means, talking about feeling hopeless or having no reason to live, talking about feeling trapped or in unbearable pain, talking about being a burden to others, increasing use of alcohol or drugs, acting anxious or agitated, withdrawing from family and friends, changing eating and sleeping habits, taking risks that could lead to death, giving away prized possessions, saying goodbye to loved ones, putting affairs in order and making a will. These signs require immediate attention and professional intervention, as they indicate imminent danger and the need for emergency mental health services. Risk factors for suicide include previous suicide attempts, mental health disorders, substance abuse, access to lethal means, family history of suicide, history of trauma or abuse, prolonged stress, recent loss or significant life changes, chronic physical illness, social isolation, exposure to suicide of others, cultural or religious beliefs that suicide is acceptable, lack of access to mental health care, and barriers to accessing treatment. Understanding these risk factors enables healthcare providers, family members, and community members to identify individuals at elevated risk while implementing appropriate safety measures and intervention strategies. Protective factors that reduce suicide risk include effective mental health care, connection to family and community support, problem-solving skills and conflict resolution abilities, cultural and religious beliefs that discourage suicide and support self-preservation, easy access to clinical intervention and support for help-seeking, restricted access to highly lethal means of suicide, and strong therapeutic relationships with healthcare providers, strengthening these protective factors through targeted interventions can significantly reduce suicide risk while promoting recovery and resilience among vulnerable individuals and populations. The impact of social media and digital technology on mental health, particularly among young people, represents a growing area of concern and research, as excessive social media use has been associated with increased rates of depression, anxiety, self-harm and suicidal behavior. Platforms that promote comparison, cyberbullying, unrealistic beauty standards, fear of missing out and validation-seeking behaviors can exacerbate existing mental health vulnerabilities while creating new sources of stress and psychological distress that traditional coping mechanisms may be inadequate to address. However, digital technology also offers unprecedented opportunities for mental health education, screening, intervention and support through teletherapy services, mental health apps, online support groups, crisis text lines and educational resources that can reach underserved populations and provide immediate assistance during mental health crises. The key lies in promoting digital literacy, healthy technology use patterns and evidence-based digital mental health interventions while minimizing exposure to harmful online content and interactions. Early identification and intervention represent critical components of effective mental health disorder prevention and treatment, as research consistently demonstrates that prompt recognition and appropriate treatment can significantly improve outcomes while preventing progression to more severe conditions and reducing suicide risk. This requires comprehensive screening protocols in healthcare settings, schools and community organizations, along with training for professionals and community members to recognize warning signs and provide appropriate referrals to mental health services. Evidence-based treatments for depression include psychotherapy approaches such as cognitive behavioral therapy, interpersonal therapy, behavioral activation and acceptance and commitment therapy, along with pharmacological interventions including selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, atypical antidepressants and other medication classes that target neurotransmitter systems involved in mood regulation, combination treatment approaches that integrate psychotherapy and medication often provide optimal outcomes for moderate to severe depression while addressing both symptom relief and underlying psychological factors. Anxiety disorders respond well to cognitive behavioral therapy, exposure and response prevention, acceptance and commitment therapy and other psychotherapeutic approaches that help individuals identify and modify maladaptive thought patterns while gradually confronting feared situations and developing effective coping strategies. Pharmacological treatments including selective serotonin reuptake inhibitors, benzodiazepines and other anxiolytic medications can provide symptom relief while psychotherapy addresses underlying cognitive and behavioral factors that maintain anxiety disorders. Lifestyle interventions play crucial roles in mental health disorder prevention and treatment, as regular physical exercise, adequate sleep, healthy nutrition, stress management techniques, social connection and meaningful activities can significantly improve mood and anxiety symptoms while enhancing overall well-being and resilience. These interventions work synergistically with professional treatment approaches to create comprehensive recovery plans that address biological, psychological, social and spiritual dimensions of mental health. The importance of social support and connection cannot be overstated in mental health recovery, as strong relationships with family, friends, healthcare providers and community members provide emotional validation, practical assistance, motivation for treatment adherence and protection against isolation and hopelessness. Peer support programs, support groups and community-based interventions that foster connection and belonging have demonstrated significant efficacy in promoting recovery while reducing relapse rates and improving quality of life among individuals with mental health disorders. Family involvement in mental health treatment is essential, particularly for young people, as family members can provide valuable collateral information, participate in therapy sessions, implement behavioral interventions at home and create supportive environments that promote recovery. Family therapy, psychoeducation programs, and support groups for family members help address the impact of mental health disorders on entire family systems while developing skills and strategies for supporting loved ones through recovery processes. School-based mental health programs represent critical components of comprehensive prevention and intervention strategies, as educational settings provide unique opportunities to reach large numbers of young people, identify those at risk, provide early intervention services and create supportive environments that promote mental health and resilience. These programs include mental health screening, counseling services, peer support programs, teacher training, curriculum integration, and crisis response protocols that work together to create comprehensive support systems within educational environments. Workplace mental health initiatives are increasingly recognized as essential components of comprehensive healthcare systems, as occupational stress, work-life balance issues and workplace factors can significantly impact mental health while employers have opportunities to implement prevention programs, provide employee assistance services, create supportive work environments and reduce stigma associated with mental health conditions. These initiatives benefit both employees and employers. Through reduced absenteeism, increased productivity, lower healthcare costs and improved workplace morale and retention. Cultural competency in mental health care is essential for addressing disparities in access to treatment and outcomes across diverse populations, as cultural factors influence symptom expression, help-seeking behaviors, treatment preferences and recovery processes. Mental health providers must understand how cultural background, language, religion, immigration status, socioeconomic factors, and historical trauma affect mental health experiences while adapting treatment approaches to be culturally responsive and effective for diverse populations. Stigma reduction represents a fundamental component of mental health promotion and recovery, as negative attitudes, discrimination, and shame associated with mental health conditions create significant barriers to help-seeking, treatment adherence and social integration. Comprehensive stigma reduction efforts include public education campaigns, media advocacy, personal story sharing, policy advocacy, and training programs that challenge misconceptions while promoting understanding, empathy and acceptance of individuals with mental health conditions. Crisis intervention services provide essential safety nets for individuals experiencing acute mental health crises and suicidal emergencies, including crisis hotlines, mobile crisis teams, crisis stabilization units, emergency department psychiatric services and inpatient psychiatric hospitalization. These services must be available 24 hours a day, 7 days a week, with trained professionals who can assess risk, provide immediate safety planning, connect individuals to ongoing treatment and support services, and coordinate care across multiple systems and providers. The National Suicide Prevention Lifeline, now known as the 988 Suicide and Crisis Lifeline, provides free, confidential support 24 hours a day, 7 days a week for individuals in suicidal crisis or emotional distress, along with resources for family members and friends. This vital service connects callers with trained crisis counselors who provide immediate safety planning, emotional support, and referrals to local mental health services while serving as a critical component of comprehensive suicide prevention efforts nationwide. Prevention strategies must address multiple levels of intervention, including universal prevention programs that target entire populations, selective prevention programs that focus on high-risk groups, and indicated prevention programs that work with individuals showing early signs of mental health problems. Effective prevention approaches integrate mental health promotion, risk factor reduction, protective factor enhancement and early intervention services while addressing social determinants of health that contribute to mental health disparities and poor outcomes. Mental health literacy represents a fundamental component of prevention and early intervention efforts, as increased knowledge about mental health conditions, treatment options, help-seeking resources and recovery processes enables individuals to recognize symptoms, seek appropriate care and support others in crisis. Mental health literacy programs target various audiences including young people, parents, teachers, healthcare providers, employers and community leaders through educational initiatives that provide accurate information while reducing stigma and promoting help-seeking behaviors. Peer support services, provided by individuals with lived experience of mental health conditions, offer unique benefits including hope, inspiration, practical advice, emotional support and advocacy that complement professional treatment services. Peer support specialists work in various settings including outpatient clinics, inpatient units, community organizations, schools and crisis centers, providing valuable perspectives and connections that enhance recovery outcomes while demonstrating that recovery is possible and meaningful life is achievable despite mental health challenges. Trauma-informed care represents an essential framework for mental health service delivery, recognizing that trauma exposure is common among individuals with mental health conditions and that traditional treatment approaches may inadvertently re-traumatize vulnerable individuals. Trauma-informed care principles include safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment and choice, and attention to cultural, historical, and gender issues, creating healing environments that promote recovery while avoiding further harm. The integration of mental health and primary care services represents a promising approach for improving access to mental health care while reducing costs and enhancing coordination of care. Collaborative care models, behavioral health consultants, integrated treatment teams and co-located services help address the artificial separation between physical and mental health while providing comprehensive, person-centered care that addresses the full range of health needs and concerns. Technology and telehealth services have revolutionized mental health care delivery, particularly during the COVID-19 pandemic, by expanding access to services, reducing geographic barriers, increasing convenience and flexibility, and providing new opportunities for innovative treatment approaches. Teletherapy, digital mental health platforms, smartphone applications, and virtual reality interventions offer promising avenues for reaching underserved populations while maintaining quality care. Standards and therapeutic relationships. Policy advocacy and system reform efforts are essential for addressing structural barriers to mental health care access, improving service quality, reducing disparities, and promoting recovery-oriented approaches. Advocacy priorities include mental health parity enforcement, increased funding for mental health services, workforce development initiatives, housing and employment support programs, criminal justice reform, and policies that address social determinants of health while promoting mental health and well-being for all individuals and communities. Recovery from mental health disorders is not only possible but expected with appropriate treatment, support and time, as millions of individuals have successfully overcome depression, anxiety and suicidal crises to lead fulfilling, productive and meaningful lives. Recovery-oriented care emphasizes hope, personal empowerment, respect, social connection, meaningful activities, and individualized treatment approaches that build on strengths while addressing challenges and barriers to wellness and life satisfaction. The economic impact of mental health disorders extends far beyond individual suffering to include substantial costs to families, employers, healthcare systems and society as a whole through lost productivity, increased healthcare utilization, disability payments, criminal justice involvement and premature mortality. Investing in comprehensive mental health prevention, treatment and recovery services represents not only a moral imperative but also an economic necessity that can generate significant returns through improved outcomes and reduced costs across multiple sectors. Hope remains the most powerful force in mental health recovery, as individuals who maintain hope for the future, believe in their ability to recover, and envision meaningful lives beyond their current struggles are more likely to engage in treatment, persist through challenges, and achieve sustained recovery. Mental health professionals, family members, friends and communities all play vital roles in fostering hope while providing the support, resources and opportunities necessary for individuals to reclaim their lives and fulfill their potential. The message for anyone struggling with depression, anxiety, or thoughts of suicide is clear: you are not alone, help is available, recovery is possible, and your life has value and meaning that extends beyond your current pain and suffering. Reaching out for help represents not weakness but strength, courage and wisdom, as seeking appropriate treatment and support is the first step toward healing, hope and a future filled with possibility, connection and purpose that makes the struggle Worthwhile and the journey toward wellness achievable and sustainable. I wish you and your family good health.